Good afternoon, sir. My name is Shayna. I'm going to be your nurse practitioner for today. How are you?
I'm fine.
Today we're going to be doing a full head to toe assessment meeting for full head to toe. It's going to be kind of a lengthy exam. You're just going to have to bear with me here. Can I ask you for your name and birth date?
John Smith, May 1st, 1990.
Thank you, John. Do you have any questions before we get started? Are you having any pain today? Okay. So first, assessing John, looking at his skin tone. John is an average male, Caucasian. He has good coloration. He has obviously been outside. He does have somewhat of a tan from the summertime. Skin is symmetrical throughout, color-wise. It is uniform in tone. Hygiene, he is well kept. No odors noted at this time. Moisturized, it's well hydrated. Temperature, I'm just going to touch you, John. Temperature is warm throughout. Texture smooth, soft, supple. I'm going to touch your skin here, John. I'm going to assess for turgor. First turgor noted, skin is elastic, meaning it's also well hydrated. Looking at John, looking for any lesions, tattoos, any scarring. Up front, I don't see anything. However, upon closer inspection on John's face, I do notice that he does have freckles consistent with papules scattered across his face. Small in size, about 0.5 centimeters to 1 centimeter. They appear brown to red in coloration and texture. Other than that, no overt lesions noted at this time. Hair color is brown. It is coarse, curly. Looking at the rest of his head, it is well distributed. No areas of baldness noted. John also has facial hair consistent with an adult male. Hair is noted to bilateral arms and legs, also consistent with an adult male. Good color of the hair, well distributed. I'm going to touch your head, John. Feeling the scalp. Scalp is easy to move. Are you having any pain, John? Scalp moves fluidly over the cranium. No lesions noted on the scalp. Scalp appears healthy. Let me look at your nails, John. Nails on all 10 fingers and toes. Nails are healthy pink in coloration. Cuticles are healthy pink with good vascularity noted. Capillary refills brisk, less than 3 seconds. No clubbing noted at this time. Looking at John's face, specifically at the head and face, position is midline. It is in a neutral position. John, can you turn your head side to side, up and down? Perfect. Motion is fluid, good range of motion. Skull is that of a normal adult male, good size, symmetrical. Have you ever had any head trauma in the past, John? No head trauma noted. No obvious signs of trauma, either no scars, no lesions. Face is symmetrical bilaterally. Shape is angular for an adult male. Coloration we talked about was even Caucasian skin tone. No facial tics or spasms noted at this time. Nose is midline on the face. It is symmetrical. It is in a neutral position. I'm going to palpate your nose, John. Does that hurt at all, John? No pain upon palpation. Nose did not move. There is no crepitus noted or movement of the cartilage. No signs of trauma to the nose. Using my pen light, can you lean forward and look up, John? Looking at the mucosa, mucosa is bilateral pink in coloration. No lesions noted. Septum is medial. No deviation noted. I'm going to include one side, John. Can you breathe out? Do the same thing on this side. Hair noted to bilateral nasal folds. No perforation noted. I'm going to palpate your frontal and maxillary. Any pain?
No.
Any pain?
No.
Frontal and maxillary sinuses are normal upon palpation, no tenderness, no swelling noted. Oh, looking at the mouth and throat, mouth, lips are symmetrical, good size on the face, no swelling noted, no cracks, no lesions noted on the lips. Are you able to open your mouth for me, John? Looking at John's teeth, John has all his teeth present. They are white in coloration. None appear loose or missing. Gums were as well present and accounted for. They are pink throughout. No bleeding noted. No lesions noted. Tongue, can you stick out your tongue for me, John? Tongue is a nice pink beefy color. It is midline. No swelling. Noted. Appears non-tender. Are you having any pain in your mouth, John?
No.
Okay. Okay, John, open your mouth nice and wide for me. Beautiful. Stick out your tongue. Say ah.
Ah.
Beautiful. Uvula moves up in appropriate fashion. So does a soft palate. Hard palate and soft palate are present. Intact. No signs of any lesions. Coloration is pink with some whitish color to the top. Normal concave shape is present. Tonsils were present bilaterally, well adhered to the wall, non-swollen. Posterior wall of the pharynx is pink, not red and not swollen. No lesions noted. Patient passed the movement with the ah. No need to check gag, but I would check a gag reflex here if needed. Okay, looking at John's neck. John's neck is midline as well. It does not appear swollen at this time. John, can you put your chin to your chest, back towards the ceiling? Perfect. Now do a full roll with your head. Normal range of motion noted to John's neck. No concerns at this time. Okay, John, I'm going to go behind you and I'm going to palpate your neck and your thyroid. Neck is soft, no swelling. Are you having any pain, John?
No.
Can you swallow for me, John? Thyroid is soft, no signs of any swelling. Thyroid moves smoothly over top of the cartilage. No concerns at this time for nodules or enlargement. Trachea was midline and in correct position. Trachea moves fluidly as the patient swallowed. There was no signs of tugging upon inspiration as the patient breathed in and out. Lastly, I'm going to palpate your joint here. Can you open and close your mouth for me? Any pain upon that?
No.
Upon palpating the joint of the jaw moved fluidly upon open and closing. No crepitus noted, no pain, no sounds upon moving. Next, I'm going to palpate John's lymph nodes. Once again, I'm going to step behind John and I'm going to palpate bilaterally both sides. So, preauricular, postauricular, occipital, submandibular, submental, sternocleidomastoid. Are you able to turn to the right? Can I turn to your left? Okay. Checking for the anterior deep cervical, moving down into this posterior cervical and the supraclavicular. No lymph nodes were palpated at this time. No swelling. Did you have any tenderness on any of that, John?
No.
No tenderness was noted. Nothing was hot or swollen to touch. Now listening for bruise. Listening to the temporal artery with the bell. Going to do the other side. Can you close your eyes for me, John? Listening over the eye. Doing the other side. Now can you lift your chin up? Listening to the other side. Thank you. No bruise were noted in any of those positions. +3 flow was noted. No concerns for bruise at this time.